Good evening, everyone. My name is Lauren Moore. I am a school counselor at Southwood Elementary School. It's Lenore County Public School, grades kindergarten through fifth. I have been there since September, and we have 17 more days till summer. Yay! So that's a little bit about me. Let's see. The first question was, in what ways can an integrated health system promote rural populations to get timely and effective care? There are numerous ways that an integrated health system can promote rural populations to get timely and effective care. First, effective exchange of information. It provides all the care providers to collaborate in order to combine their efforts in regards to their patients' health and well-being, both mental health and their physical health. The primary care provider will be knowledgeable in the treatment that his or her patient is receiving with their mental health care provider and vice versa. This will also help identify high-risk patients as well as catch mental health symptoms before they become serious. Offices will be able to be more sufficient when it comes to managing patients' medicines and care plans. I think this is important because your primary care provider may refer you to your mental health care provider, but if they do not collaborate and exchange that information, the medicines could be, they could intertwine and co-react. So it's important for a patient and to know what medicines they're taking, as well as all the doctors that are involved with that. The next question is, how might a non-integrated health system prevent care in a rural Actually, I'm going to go back to, number one, because I did write another note down for one of the article that we read. I put that in rural communities that mid-level or fully integrated collaboration would be more beneficial for rural areas due to the cost and travel to access care. I lived in a rural community all my life. I'm from Jones County, so we have a doctor or a mental health provider is usually 30 miles away. So in this case, especially if it's fully integrated, that will definitely benefit the patient and families really in these communities. I feel implementing integrated healthcare systems will allow patients in rural communities to feel more at ease and follow up with their appointments, because this will not be so much of a hassle since professionals are working together, and some agencies may also be available in the same offices. That way, when it comes to follow-up appointments, in communication, really, I mean, just transportation is a big issue in rural communities, as well as the poverty level, which comes with the transportation. So now the question: how might non-integrated health systems care? How might a non-integrated health system prevent care in rural populations? This poverty, transportation. Lack of mental health agencies and training. You find in many rural areas people have a stigma when it comes to mental health, and that is very true. And also people go to their patients, or these people in the community go to their primary care provider, and they come with symptoms of depression or anxiety or manic depression, anything, and these primary care providers, they prescribe medication, but it may not have to be medication or anything if they could, work with a mental health care provider. So that is what I think of those, and I hope everyone has a wonderful night. Thank you so much.